Hi everyone, so in this video I would like to share with you how I do my sectional extraction on lower molars. So as you can see on the highlighted drawings, on the red line is the marking where I would use my burr to decoronate the crown, and I will try to preserve as much as possible of the mesial and the distal portion of the roots, which is highlighted in the green line, and I like to save this area so I can use it for elevation. I also use a triple XL 700 burr to remove some bone between the root of the distal of the mesial root and the mesial of the distal root and the forcation bone on the expense of the root rather than the forcation bone. The reason I like to decoronate is because it will avoid the mesial portion of the crown hitting the distal portion of the crown when elevating, especially with curved roots, and also will make losing orientation a lot harder. So I start on a horizontal section first. So I go from the buccal, and this will allow me to have straighter access to the crown. And also if the patient having pulpitis, you can access the nerve a lot easier and quicker and apply intrapulpal injection if needed. Once I do that, I will use my elevator to break down the crown. Then it's similar to like doing an endodontic axis. So again, using the burr in an elevator in a horizontal position, I will try to expose the pulp chamber and preserving the mesial and distal portion of the crown. Once I expose the pulp chamber, then you can see clearly how many canals are there, and then you can do a very successful section without breaking the mesial or the distal root. Now I will remove my burr into a more vertical position. I will go in between the canals as if you're trying to do an endodontic perforation into the forcal bone, and then slowly move your burr to the buccal and the lingual without touching or cutting through the buccal bone to preserve it for any future implant placement, or cutting through the lingual bone again to preserve it for implant placement and also to avoid injury to the lingual nerve. So with good magnification and good light, you can clearly see when you get very close to the gum margin so you don't cut through the gums. Once I finish with my vertical section, then I will change my burr to the longer burr, which is a 700 triple XL burr. You can get this burr from Salvin from the US. There's a company in Australia you can buy it from as well. Feel free to leave me a comment. I can show you where you can buy it from. So I would go in between the mesial root and the forcation bone, and between the distal root and the forcation bone on the expense of the root to preserve as much bone as possible on the forcation area. Again, with good magnification and light, you can see clearly. What I like about this burr is it keeps the head of the handpiece away from the sectional side. Now, once you have finished with your sectioning, I will use my mesial portion and I like to use luxators and elevate the mesial root. If I finding a lot of resistance with elevation, I will go and do I will remove more bone or do like more kind of like gutter between the mesial bone and the root and go a bit deeper towards the apical area, especially if the roots are too curved. Then for the distal root, I will come from behind the patient and I will use my luxator on a more vertical position, and again try to do a bit of rotation to push the distal root into the space towards the forcation area. By the way, this 45 angle handpiece doesn't allow any air coming through it. It only allows water or coolant coming through it. Now a bit of curettage through the sockets to make sure there's no granulation tissues left. And then you can choose to do a socket grafting after that, which I will probably explain in a different video. If you're happy with the content, please make sure you like this video, subscribe to my channel, and just try to click on the notification bell so you can get notified of any new videos. Thank you very much.